First and foremost, thank you guys for taking time out of your busy schedule today to join us for our annual State of Vail Health. I know that you have many things going on, and boy, what a year it's been. As I was reflecting back on this presentation, I was thinking actually how fast the first 3 years that has taken place here has happened. My wife and I were so excited to move to the Valley. We have 2 young children, and everything we thought it would be in terms of living here has been surpassed. And a lot of that has to do with the fact that it's an amazing community where everybody leans in no matter what the crisis. It's a wonderful place to live. It's a wonderful place to recreate. But we also moved here because we wanted to have an impact. And so much has happened in these last 3 years. 2 of the 3 have been navigating a pandemic. But boy, did we learn a lot through that process. And so let's talk a little bit about that. And I want to start with population health. A lot of people will say, what is population health? Well, in its simplest terms, it's how do we think about health in a more holistic way? And I don't mean H holistic, I mean WH holistic. How do we think about physical health, behavioral health, social determinants of care? How do we think about each of the different types of people that lives and works in this valley? Maybe full-time, maybe part-time, maybe it's people who come and visit to enjoy our mountains. But either way, how do we think about everyone? And what do we do to address some of the differences in the way healthcare gets used? How do we make people healthier and get them upstream to a lot of these problems? And when we talk about COVID, as much as we're all tired of talking about COVID, it really underscored the importance of taking this sort of approach. Because your best defense against COVID is actually good baseline health. And if you do have genetic predisposition to some type of chronic disease, whether or not that's diabetes or cardiovascular disease or what have you, it's important to manage that chronic disease because that too is an important way to fend off something like COVID and to live your best life. So when we think about, hey, how does population health drive what we do? It's really all about working together to take care of everyone, regardless of their ability to pay, regardless of where they live in the valley, regardless of whether or not they're full-time, part-time, or a visitor. And that's the transformation that really drew me to Vail Health. And I'm so thankful to a board who's been right there alongside myself and my management team to come up with a vision on how we not just be one of the best orthopedic centers of excellence or do a great job with cancer care, but how do we really focus on population health? We also talked at our last meeting a bit about growing local and regional healthcare services. And a lot of people have said to me, well, why is Vail Health in Summit County? Why are you going into Roaring Fork Valley? Well, the simple answer is that many patients from those valleys have been coming to us already. And part of that's related to the fact that we have wonderful provider partners like the Stedman Clinic and Vail Summit Orthopedics and Neurosurgery who've been providing care in those valleys for decades. And as you all know, it's pretty difficult to traverse over the Vail Pass or get through mudslides to the canyons. And so trying to provide more advanced care closer to home is the right thing to do because at the end of the day, healthcare is local. And we are a nonprofit 501c3 organization, independent healthcare organization. We're not owned by a large front range system. We're not owned by shareholders. We're not owned by private investors. We are a nonprofit entity whose mission is to improve the lives of the people we serve. It's really important for you to understand that distinction because we're trying to keep healthcare local and to not try to send it to Denver and to not take margins and send it off to shareholders, but rather reinvest it in things like behavioral health or our response to COVID. And by the way, to close out COVID, this past year, if you remember this time last year, we were all seeing each other for the first time in a long time, embracing as we were waiting for our COVID vaccinations. Remember the piano playing, people crying? I know Eagle County set up many testing centers. Man, have they been a great partner. The state enabled us to be a vaccine distribution center, really helped stand up a lot of our efforts in that regard. Truly a group-wide, community-wide effort. And I'm so thankful to all of you who had the courage to get vaccinated I'm proud to report that 90+%, it may even be 95+% of people who are eligible for a vaccination have received them. And again, doesn't prevent you from getting the virus, but it definitely keeps you from being severely ill from it. So thank you guys for doing that as well. But when we talk about population health, it also has to be accessible, which means it has to be affordable. A huge thank you to the governor and his cabinet, to all of our elected officials, whether or not it's Representative Dylan Roberts, Senator Kerry Donovan, Representative Jay McCluskey, all the Eagle County commissioners, our elected officials in Summit County who've been incredibly welcoming and helping us get set up further there. Everybody's been trying to work on ways that we can make healthcare more affordable. And there's a lot of progress been made in that space that I'll talk to you about a little bit later. I'll also be talking to you about behavioral health because, again, you can't separate physical health from behavioral health. And all of these things together come back to population health. And that's been our focus in 2021. How do we have rapid COVID testing? How do we do vaccination clinics? How do we try to keep people healthy? How do we take care of the vulnerable and the underserved? How do we make it more affordable? And how do we think about behavioral health? Next slide, please. So again, I mentioned COVID already. I'm not going to spend much more time on it, but to say there will be additional variants. Unfortunately, this is the state of this virus. The key to it, stay healthy, get vaccinated, and let's lean in and help one another, especially those who are vulnerable. When we talk about some of the growth that we've done, it's not just been in new locations. I want to make sure you understand that in addition to opening up a new East Wing, which is your hospital of the future, we also have added high technological services like new robotic surgery. And you say to yourself, what is robotic surgery? Well, this picture here tries to show you one of our key surgeons, Dr. Turner Lyle. He is amazing, doing a robotic case. This is how the surgeons of the future are being trained. This lets surgeons be much more precise. It minimizes infection issues. It truly is the way that surgeries will be done in the future. And you now have access to this in your hospital here in the Vail Valley. So a huge thank you to all of you who've helped support that. In addition to that, we've added a ton of other services. If you've noticed, we've started to grow a little bit in Avon at Buck Creek. When Centura left that first floor, it's now part of Vail Health and CMM. We've increased behavioral health services and providers. 50 plus behavioral health providers and staff have been added to our valley. And we're very pleased that the Dillon Health Center just opened here in November of 21. So when we talk about Summit County, here's some pictures we took so you could get a sense of just how comprehensive and how beautiful it is. So there's an ambulatory surgery center. That's a fancy way of saying it's outpatient surgery, like our Vail Valley Surgery Center. And we did that in conjunction with our surgeon partners, the Stedman Clinic and Vail Summit Orthopedics and Neurosurgery. But it's not just an ambulatory surgery center. We have enhanced oncology services there to include chemotherapy, to include breast imaging, to include other things related to oncology. We have our Howard Head Sports Medicine Physical Therapy services there. And we try to not only deal with post-surgical needs, we try and do prehab and how do we keep people from getting injured. We have Colorado Mountain Medical there, primary care, specialty care, urgent care, and we've actually integrated urgent care and primary care because we believe that's actually the correct model. If you haven't had a chance to see it, you should check it out. And to all of our partners and colleagues who have joined us today from Summit County, thank you again for being so welcoming throughout the entire process. We look forward to serving you and the people that live in your valley well into the future. As we shift over to the Roaring Fork Valley, we actually were following Stedman Clinic, who for many years has talked about how do they take their mountain resort medical destination model and grow it in other ski resort towns. And when the opportunity to go to the Roaring Fork Valley, and more specifically Aspen and Basalt, presented itself, we were pleased to be able to go along with them. But we wanted to go in there as partners. That's why we also included Aspen Valley Hospital as a joint venture partner in what we're doing over there with the ASC. If anyone from the Roaring Fork Valley is listening, we too thank you for being so welcoming as we all work together to provide the best orthopedic care in the world. And we're very excited about the prospects there. We'll also have a Howard Head Sports Medicine location there. And Stedman Clinic will also have its Stedman Philippon Research Institute services there so that we can continue to be cutting edge, not just in our valley, but in the other valleys we serve. So let's talk about making healthcare more affordable. This is on the minds of all of us because, as we know, it's hard enough to live here in the mountains because housing is expensive and childcare is expensive, and really everything is more expensive because it's hard to get people and things here, right? And if there was an unintended consequence of the pandemic, it's that people are now able to work more remotely, which means where do they want to live? In a beautiful place like the Colorado mountains. And so that's actually exacerbated some of our problems, including the cost of housing, which means we've got to remove this issue of affordability from a healthcare perspective. Now, we can't do that on our own because not all the care that people receive is provided at our hospital or our health system. It's provided by some of our other provider partners in our valley, but a lot of care gets provided back in Denver. So this is a very comprehensive process, and I want to make sure you know that a lot has happened to date. We were doing free COVID testing and vaccinations before there was ever any government reimbursements and guarantees. To date, since 2019, when I got here, we've helped reduce the health insurance premiums by up to 35%, in large part due to partnerships with local insurance plans. The reinsurance legislation that the aforementioned legislators, Carrie Donovan, Dylan Roberts, Jane McCuskey, put into place made a huge dent, and we're incredibly grateful for them. But I want to make sure you know healthcare providers such as Vail Health actually help pay for that. We also negotiated reimbursement rate reductions with Anthem, which is the Blue Cross Blue Shield commercial insurance option here when Kaiser left the market to help bring premium prices down. We increased our financial assistance to 500% of the poverty level. What that basically means is if you make below a certain amount of money, we'll give you significant discounts on the care that you receive. We've been working with the county and the state on ways that people who qualify for Medicaid or even Medicare get signed up for it, because that's a wonderful insurance coverage plan to have. We've created Olivia's Fund to provide free access to behavioral health care. We've reduced prices in MRIs. We've launched preventative screenings on the Mirror Bus. This is just a sampling of what we've done since 2019, while we're also navigating the pandemic, onboarding Colorado Mountain Medical, creating Eagle Valley Behavioral Health, opening up a new tower, opening in Dillon, opening in Basalt. I want to make sure you understand that this just isn't lip service. These are the things we're doing. And we continue, as we look to the future, to do more, including partnering with the Vail Valley Partnership. Chris Romer has been an unbelievable partner in this regard. He's worked with us on ways that we can come up with what might be a more affordable health insurance option for locals. We were waiting to see what the public option, which is now referred to as the standard benefit design, which came from the legislation in the 2021 session. It was voted on in May of 2021, that attempts to bring to all the places where health insurance is sold a broader coverage, lower cost insurance option. And so in addition to doing that, we're also looking at ways that we might create the merchant pass equivalent for people who live and work in this valley. The point is, more options will be coming. We'll continue to stay focused on this because we don't want affordability of healthcare to prevent people from accessing it. We don't want it to be another problem and reason that people decide to leave this community. We don't want it to be another challenge for our businesses who have plenty of challenges without all of that. Next slide, please. So behavioral health. You know, one of the things that really made my wife, Sarah, and I want to come here, as I mentioned before, is to have an impact. And when Mike Shannon, the former board chair, shared with me that there had been this grassroots community-wide initiative looking at behavioral health, it started back with the marijuana tax initiative. It really piqued my interest. And I have again been blessed to not just have Mike, who recruited me here, but Eric Affelt, who was his successor and our current board chair, and an entire board who had the foresight to say, we have a responsibility to do something about this behavioral health crisis. We have a responsibility to do something about affordability. We have a responsibility to ensure that we're thinking about how we keep people from getting sick and not just treating them when they do get sick. I'm forever grateful for our board, and I'm privileged to work with a community that, again, knows how to lean in. I remember my first Eagle Valley Behavioral Health meeting, and actually it wasn't even Eagle Valley Behavioral Health at that time. It was just what was going on in Eagle and Summit counties. Eagle County commissioners were there. Jeff Schroll was there. uh, Heath, you name it, paramedics, law enforcement, education, other nonprofits. Everybody was trying to figure out what should we do. And when we created Eagle Valley Behavioral Health in the summer of 2019, it was a milestone mark for this valley and for adjacent valleys. And since that time, we've added 50 behavioral health providers and staff. We've integrated behavioral health into primary care and specialty care at Colorado Mountain Medical. We've integrated them into the schools. We've put them in the jail. We launched a victim first care. It's sad that we even have to have a sexual assault nurse examination and forensic nurse examination program. But sadly, when this happens to someone, you have to have this service. Otherwise, they were leaving our valley to get it. And so again, how do we provide more advanced care close to home? How do we ensure that things that have been lacking are now here? We're very proud of our Mountain Strong Employee Assistance Program. It started with our own employees. It's now expanded to 11 businesses and serves over 8,000 different people in Eagle County. And it's about to expand to Sweetwater and to Leadville communities. In essence, what this does is it gives companies a chance to offer expanded behavioral health services that don't cost their employees anything to see a behavioral health provider. We couldn't do that until we had more behavioral health providers available. But this is a way that you proactively get upstream to prevent problems as opposed to letting them fester and having someone show up in our emergency department and or have to be admitted to our inpatient units or somewhere back in Denver. Again, which pulls people out of the valley. And that's the least effective care, to be quite candid with you. I'm also incredibly proud that we've been working not just with our foundation, but with other nonprofit organizations. And we've come up with 50 funding partner agreements that says, rather than each of us going to the same set of benefactors to ask for money, let's do it on a united front. And let's make sure we're putting those dollars to the best use that we possibly can. And recall that we gave $60 million in cash and in-kind services to Eagle Valley Behavioral Health when it was created. Well, in addition to that, we said we'd raise $100 million. Well, I'm proud to report to you today that $46 million of that $100 million has been raised. And more importantly, I'm grateful to the benefactors that live in this valley who give of their time, their talents, and their treasures like no place I've ever lived before. I don't want to start calling names because I know I'll miss someone, but each and every one of you knows who you are. And it doesn't matter if you gave $1 or $1 million. It's all helping us figure out ways that we enhance behavioral health services in this valley. And I am so grateful to the state government, the local governments, the community, and everybody who's been involved. And all of this, I'm excited to share with you, is culminating in our new Edwards Community Health Campus. Next slide, please. So many people, when we were buying up real estate in the valley, were like, what is Vail Health doing? And why are you buying up real estate? And that's a fair statement when there's not a lot of real estate to buy. And a lot of people, I think, were wondering, what are we going to do with that swatch of land that was formerly referred to as North Star, just off the I-70 interchange on the Edwards exit? Well, I'm proud to tell you today, this is our new Edwards Community Health Campus. It was strategically chosen because it's mid-valley, which, by the way, is where the most dense population in our valley is. It was chosen because it's easily accessible and highly visible. It was chosen because it was big enough to not just let us put a new inpatient facility, which has never been done in a mountain community before, but also intensive outpatient service. The Uyghurs Intensive Outpatient Services Clinic is going to go on this campus. We also, though, have co-located other services like the community market, which is our local food bank, My Future Pathways, which helps young people who are trying to find ways to do productive things outside of school. We're going to have Mountain Family Health Center there at some point. We already have Colorado Mountain Medical there with integrated behavioral health. There's so many things that this campus can and will be for people in needs. And many of you know the green roofed buildings you see on this picture here. I think the thing that's most well known in Edwards seems to be the subway. That's kind of on the north side of the campus. But suffice it to say, the big brown building in the back is the new 28-bed inpatient facility, 14 adolescent beds, 14 adult beds. And if you haven't been watching, probably the biggest second order consequence to COVID is the behavioral health crisis that's been created worldwide in our country, in our state. And it was already bad in all of those places and hyper acute here in the mountains. In fact, a state of emergency has been declared by all of the large pediatric groups and children's hospitals, saying we've got people waiting in emergency departments trying to get to these types of services. And we're so proud to be able to offer them closer to home, because now, in the unfortunate event that one of your loved ones needs this service, and we hope to get further upstream to it so you never do, but even in that world, there's times when you do need it. You and your family can stay closer to your loved one who's receiving these services, as opposed to trying to figure out ways to travel over passes, get a hotel, stay in Denver, maybe Grand Junction, heck, maybe it's somewhere else altogether. This campus, this facility is not Vail Health alone. It's this entire community. It is an example of how when we lean in and we put our best foot forward, we can do things that people told us would never be possible. And none of it happens without benefactors, board members, community members, my management team, our providers, our staff. Thank you. I'm so proud of this. The PUD process formally finished and the Eagle County Commissioners approved it on December 7th, 2021. And I'll remember that day the way I remembered the day that we first approved Eagle Valley Behavioral Health in our board. These are moments in time that will forever change things in our valley. And I'm so happy and so excited to share this with you guys. We hope to finish our detailed drawings and go through the rest of those steps and try and break ground sometime later this year. Opening could be sometime in late 2023, early 24. I don't want to commit to anything at this point because there's so many darn unknowns associated with supply chain challenges and things of that nature. But really, pat yourself on the back and be excited about this wonderful facility that we have. Next slide, please. But I want to make sure you know, even though we have been navigating COVID and opening up a new tower and opening up in Dillon and Basalt and further growing EVBH and planning for this new inpatient behavioral health facility, we've never taken our eye off the ball, because at the end of the day, our primary responsibility is to provide high quality care in a safe environment. And have we gotten it right every time? Absolutely not. Are we relentlessly trying to get it right every time? Absolutely yes. And I'm so pleased to report that we have a safety grade of A from the Leapfrog group. It was a D my first 6 months here. The team has worked incredibly hard to change that. I want to thank our providers and our staff, especially Dr. Reg Francios and Amy Levine, who lead our quality committee of the board. We received our triennial Joint Commission accreditation with a record low number of findings. We have a ton of other things going on, but you'll hear me talk about them a little bit later. I just want to make sure that you know we have not taken our eye off the ball of quality and safety or patient experience. And I think you'll see that in this next slide with our 2021 awards and distinctions. The thing I'm probably most proud of in this is, despite all that's been going on, not just the Leapfrog A grade, but the 2021 Press Ganey Guardian of Excellence Award. To get this, you must be in the 95th percentile from a patient experience perspective. This was in our emergency department. And if you want to talk about a place where COVID has manifested itself in the rawest and sometimes most difficult ways, our emergency department is one of them. Not just because they see the people who've been severely impacted by COVID, but because they have to listen to oftentimes the highly polarized opinions on masks and vaccines and people who are anxious and angry and mean and rude. And we've lost some of our own employees. A 30-some-year-old employee of ours who worked in the emergency department died of COVID. Of it, not from it. And it was brutal to our team. We've had all sorts of other tragedies happen outside of COVID that end up being brought to this emergency department. I could not be prouder of the men and women, of the doctors and staff who day in and day out, despite all of that, still provide excellent care. And there's many other things I could talk to you about on this. Probably the biggest one, other than ones I've said, is this designation as a community mental health center. This is an enabler for us to help bring in resources to allow us to provide enhanced services here in this valley. This was the first one in 40 years. And this is a big, big deal, not just for Vail Health and Eagle Valley Behavioral Health, but for the entire valley. Next slide, please. So, as you probably know, many of you are business people or you've worked in organizations where you oftentimes will do a strategic plan. 3 years is about the sweet spot for that. It's long enough to not have you be doing a new strategic plan every year, but not so far out that the external environment changes so much that it's really no longer relevant. And I'm very pleased to say that we've started our new fiscal year 22 to fiscal year 24. That's a 3-year plan. And it's built off this strategic framework. And again, huge thank you to our board who helped develop this and to so many people who've been involved at the frontline level. But it really starts with your mission and vision, which you're going to hear a little bit more about later. And that drives your pillars, which for us, and remember these words, affordability, accessibility, population health, and sustainability, because none of these other ideas are good if we're not financially sustainable. And how does that inform strategic initiatives? And how do those inform tactics? And most important, at the bottom here, what are our strategic enablers? And people and culture are the most important thing that we have. And in fact, when we think about the Great Resignation and all that's going on with trying to find good talent, this is our most critical pathway. Figuring out how we solve for the compensation problem, the housing problem, the daycare problem, the affordable health insurance problem will be our biggest challenge. Next slide, please. So when we talk about that transformation that I mentioned at the beginning, from sick care to population health, and how our organization has evolved from recruitment of me to the turnover in our board to what's been going on in our community as we've tried to be more inclusive, to everything that goes into transformation, I want you to see that these changes over a 5-year period have been pretty darn significant, and they'll continue to be that way until inevitably we've gotten it right. But you really can't go anywhere, next slide, without having your compass, which in my mind is your mission. Who are we? Our vision, what do we aspire to be? And we started a process that included input from our board, from our providers and staff, from the community, from our management team to say, hey, our mission's too long. It's not really reflective of who we are, who we aspire to be. So let's work on changing it. And I'm proud to share with you today, our new mission is elevating health across our mountain communities. And that communities has a whole lot of meanings. It's not just Eagle River Valley and Summit County and Roaring Fork Valley. It's also the communities within the communities. Our Hispanic and Latin American community, our Up Valley community, our Mid Valley community. How do we think about everyone and how do we work on elevating health? And our vision, to be the leading mountain healthcare system, attracting the best talent to advance quality health for everyone in our communities. Everyone. Can't emphasize that word enough. Thank you to the team, to the community, to the frontline staff who was so instrumental in developing this. And let's go to the next slide. So how does that mission and vision manifest itself? And it comes back to those pillars. If you almost think of Maslow's hierarchy of needs, on that bottom rung where it's usually sort of shelter and safety and food is population health. How do we connect all aspects of healthcare across the entire lifespan, cradle to grave? And how do we delay or decrease the development of chronic disease? How do we see primary care physicians on a regular basis, have our blood work done, maybe even do some genomics to understand our genetic predisposition and build a population health plan around it? And how do we do this for everybody in our valleys and not just those who can afford it? Which leads into the next one, which is affordability. We have to remove that as a problem. It's got to go away. There's a lot that's happening and more to come. Accessibility. This isn't just about affordability. Accessibility is making sure that people have access to the right care at the right time and the right location, making sure that we've removed cultural barriers, making sure that it's more convenient, which is why we've ended up growing in other locations. So an accessibility problem is I couldn't get through the canyon because of a mudslide. And lastly, sustainability. Next slide, please. So when we think about the actual specific strategic initiatives, right? Again, Our employees are the starting point. And it really isn't just our employees, it's our providers. It's any and everybody who works at Vail Health to enable us to carry out our mission and our strategic pillars. If we don't focus on them and figure out a way to make it reasonable for them to live here and want to stay here and grow their career and help them tie back what they're doing in their personal job back to our broader mission, we can't do anything. So we'll always be about our employees, and we've got more work to do in that space. We're going to be really focused on population health infrastructure. Well, what does that mean? Well, it's not just primary care physicians or behavioral health physicians. It's also making sure that we have social workers, health coaches, that we make it easy for people to receive care that is preventative. It's working on a health insurance option that ultimately is designed in ways to encourage the right behavior and discourage the wrong behavior. How do we have lower cost options in outpatient settings? The hospital is the most expensive place to go. And that's because the care is really acute there. But if you can be cared for in an outpatient setting, let's go there. So that's why we've set up more urgent care centers. And we're looking at freestanding imaging centers. And how do we look at lab costs and all of those things that, again, are necessary to diagnose and treat care in a more affordable, lower cost setting. We'll continue to expand behavioral health. We're just in finishing chapter 1. Eagle Valley Behavioral Health has got a bright future, and it's going to be doing some more amazing things, and it'll continue to do it with our community and with the other nonprofits. But we're very excited to continue to focus on behavioral health expansion. In fact, I will tell you, our key service lines, it'll always be orthopedics. As long as we live in a place with these beautiful mountains where people unfortunately get hurt, orthopedics should and always will be a focus. But so will oncology, because people receiving chemotherapy treatments can't travel back and forth from Denver without it being a burden or a potential barrier. But behavioral health is another key service line for us, as is primary care. These are the things that matter, and we've got to grow behavioral health still. You heard me talk about local health insurance products. You heard me talk about growing our oncology program. We have some amazing oncologists here, Patty Hardenberg, Dr. Eckhart. There's so many people who really do great things for us. We want to continue to grow that program. And then lastly, almost like the first topic of employees, the key for us has been partnerships. Whether or not that's with community at large, our elected officials, our benefactors, you name it. Our strength is our diversity. Our weapon is our unity. And what makes this valley strong, what makes it great to live and work and be able to do impactful things is that unity, is when we lean in and we actually take advantage of the fact that someone has different perspectives, and we listen and we partner. Because when we do those things, there's nothing we can't do. So I want to again thank you for your time today, your participation. I want to thank our board of directors, our community leaders, the municipal governments, the benefactors, the people, my frontline staff who has been on the front line dealing with COVID and who, to be quite candid with you, is exhausted. Our providers, everybody, thank you so much. I look forward to entertaining your questions now and look forward to hopefully seeing you guys again this time next year.
Thank you, Will. We have a few questions that have been submitted so far. And so I would like to remind everyone, if you have a question you would like to ask, please enter that now into the chat feature and we will address that. So to start off, one of the questions was, what did the Vail Health organization learn over the past couple of years that will be valuable as we move into a post-pandemic, not post-COVID world?
Well, that's a great question. It kind of ties back to where I started, which is I think that COVID affirmed the direction in which this board and the management team was headed pre-pandemic, which was how do we focus on getting people well and healthy and getting out in front of chronic disease? And how do we remove barriers that are affordability and focus on behavioral health? Because when the pandemic hit, the most vulnerable people were those who didn't have good baseline health. and who couldn't afford to access healthcare. And oh, by the way, exacerbated an existing behavioral health problem because behind masks and not going to school, while necessary at a certain stage in that pandemic, is not sustainable as we shift from pandemic to endemic. So in my mind, it underscores stay healthy, manage chronic disease, get your boosters, and help one another, help the vulnerable, whether or not it's the elderly or people who don't have access to things that others do. But it really made me realize just how important staying well and healthy is and working together to solve problems.
Next question is, I'm having trouble making appointments when calling Colorado Mountain Medical. After a delay, I was able to get an appointment with a psychiatrist, but it was canceled soon after. I was offered a Zoom appointment at a later date, but I declined. Is Colorado Mountain Medical able to provide the medical providers and behavioral health providers needed to treat the people who live here?
That is a very good question. And I'm glad someone brought it up because we're not just looking for, layups here. Colorado Mountain Medical has been part of Vail Health for 2 years now. And we are moving into phase 2 of integration, which includes now converting them from their phone system to ours, making more investments in not just providers and staff, which they've almost doubled in size, by the way, in the 2 years since they've joined us, but also investing in things like a new phone system and in more servers and switches and all of these things that enable a phone system to work the right way. We've in fact just hired a new company with a software program that allows people to do self-scheduling that's coming over the next 60 days. We have failed you in that regard. Vail Health has failed CMM. And CMM in turn has not been able to meet your needs. And we are terribly sorry for that. It's a combination of the rapid growth, a combination of older phone systems that can't handle what it's grown to. And oh, by the way, we too are feeling the same staffing problems that you're seeing in the hotels, that you're seeing in the restaurants. And a lot of the people that we're losing, all of us, are the people that are in those types of jobs that do answer the phones or ultimately, responding to whatever the requests are when you make those calls. So that is on us. And we have a responsibility to you to fix it. As it relates to the appointment that I believe you have with the behavioral health provider, I know that we had one who had to go out on a leave, and that created some significant problems for us. I'll pause there and ask Chris Lindley if you want to sort of chime in there for anything that I may have gotten wrong.
Thank you, Will. No, I think you covered it well, and we're in the process of continuing to try to hire more behavioral health providers in the Valley. What we've learned is even by adding additional 50 over the last few years, there's still more demand than what we do in terms of offering. So we'll continue to advance that team as we go forward.
Bottom line, we've been a little bit of a victim of our own success with rapid growth and so much pent-up demand that once it did become more obvious how you would get it, we got overwhelmed. And we're very sorry for that, and we'll get to work on fixing it.
Next question. Will the Edwards Inpatient Behavioral Health Facility provide long-term care for addiction and mental health? What would be the minimum and maximum length of stay? Where is the Valley on providing a medical detox facility?
Great. I'm going to take an initial stab at this. I'm looking at my phone in part because Chris and I were just texting about this because I missed it and proactively including it in my update on that campus. But Chris, I'll take a first swing and then you correct me where I'm off here. The behavioral health facility would be a fully licensed inpatient behavioral health facility licensed to Vail Health, and it can treat all behavioral health patients, be it adult or adolescents. There's no minimum or maximum stay. However, the average stay will be somewhere between 3 and 5 days, maybe even less than that, because we are not a acute, tertiary, quaternary type inpatient behavioral health place. We are a place where patients can come to stabilize, hopefully as quickly as possible, get them connected to the right outpatient services, because that's actually the more effective way to treat this. But if someone needs long-term healing or higher level services, unfortunately, that will be something that we will have to send out. We are not planning to have a detox facility on the Edwards campus. And I just wanted to call out for a second the old Edwards Estates community members who've been unbelievably tolerant of us trying to put this in what amounts to their backyard. And it's not to say that it didn't affect other communities as well. But as you can imagine, that's a very difficult thing for them. And we're so grateful for the feedback that they gave and the flexibility that they had with us as we were trying to strike that balance between giving the community what they need and not negatively impacting their lives. So, Chris, can you please correct me where I may have been off or add anything that I may have missed?
Well, I think you covered it really well. One thing I just want to add is just like our physical health hospital in Vail, it's not a place for people to get the long-term healing that they need. It's a place to get patched up, to get stabilized. And where the real healing takes place is always in the outpatient facility, whether it's physical health or behavioral health. And we're looking to do the same thing in our future inpatient facility, where it will be, we hope, a very short stay for most of our residents. We'll get them stabilized, and then we're going to connect them with the right long-term services here in the community to get them healthy long-term, and hopefully they'll never have to come back.
On that same topic, what are the ages included for adolescent behavioral health beds in the Edwards Community Health Campus?
Will, I'm happy to address that too real quick. We'll be able to serve anybody from 12 and up to start with, and then we'll be looking to lower that age as we go forward.
In addition to that, there's a question about, will you be adding employee housing on the Edwards Community Health Campus?
Yes, as you know, as part of the process of getting approval to build something, you have to build out a certain amount of employee housing. And we, of course, will honor what the commitments were for that. But I'll just go ahead and tell you that we're looking at something much bigger than that. In fact, we are looking down valley, mid valley, and up valley, both in terms of master lease agreements. For some of the developments that are happening in those locations. We're under NDA with some other folks talking about ways that we may actually build some of our own. And so housing, from my perspective, is probably the most heavily weighted variable in the employee retention and recruitment equation. And we will be doing much more than what was even required for us to do this new Edwards Community Health Campus. And Craig or Chris, if I got that wrong, please correct me.
This is Craig. You got it great, Will. The only thing I would add is, in addition to meeting our requirements for the Edwards site, part of the master plan for that site required all of the square footage that was approved to be used for these behavioral health and population health uses. We're going to need that square footage. So we're going to identify our housing opportunities in close proximity, but not on the same campus, so that we can build that out to our full potential for healthcare uses.
Thank you, Craig. Craig Cohn is our Chief Real Estate Development Officer and led the project for the behavioral health facility along with Chris Lindley and Michael Holton. So thank you again for that, Craig. And Craig is also out there looking for real estate and trying to find places. And as you know, you can't build your way entirely out of this, but we do need to do more. And I look forward actually to this time next year when I'm showing you a slide that shows you just how many more housing opportunities we provided over this next year. So real big priority for us.
On that same topic, Will, one of the questions is, are there any employee housing assistance programs offered through Vail Health currently or coming soon, and would any be offered in Summit County?
Craig, would you mind taking this one as well?
Happy to. Yes, we have done programs in the past, and we will do them again as part of some of these new developments, where we do offer down payment assistance for our employees looking to buy a home within the county. So within the entitlement process, especially for the Edwards site, we did build into our housing program the ability to help our staff buy their own residence, as opposed to just helping them with leasing residences. That's a program that certainly we would love to expand into Summit County, but at this stage, with the how new I should say that building is, we have been working on master leasing property at this time. We've also made contributions to the county for employee housing that they're building as part of that development. And as we get the facility a couple more months into operations, we will also be looking at opportunities to find land in Summit County as well.
Thank you. One comment said, we would love to see a geriatrician incorporated into our local care model. What are you doing to better provide specialists to address the needs of our aging population?
Right. It's kind of a comment and then a question. They're related, but not totally the same. So to the latter part about what are we doing to provide more specialists or better specialists to address the needs of our aging population, I'm pleased to announce that we've added ophthalmologists. And if you haven't met Dr. Godin, she's pretty amazing, and we're going to be expanding those service offerings. And there is ophthalmology provided in this community, I realize, but there's a pretty, significant demand for those services. We have been, adding other subspecialties that help that population, especially in the form of urology and dermatology. And as we all age, we know that inevitably we deal with the likelihood for increased cancer diagnoses. We've also added a new cardiologist to complement the one that we have here. We're very excited to have her in town. New pulmonologists for people who may be dealing with pulmonary type diseases. But geriatrics is definitely one that we want to look at, especially as we're looking at primary care and getting upstream to problems. But again, part of what we're trying to do is address some of the critical pathways within Colorado Mountain Medical, such as the phone systems that we talked about before, such as space, which is why we're building out the 5th floor of the new East Wing Tower for Colorado Mountain Medical and Mountain Surgical Associates. It's why we're building out what was previously shelled 3rd floor of the Buck Creek building in Avon. For those of you who don't know, Buck Creek is where Colorado Mountain Medical is located behind the Northside Cafe. That'll add 10,000 or so feet. We're looking at how we use some of the office space in the aforementioned Edwards Community Health Campus. We're looking at the Burger King that's in Eagle. In anticipation of that question, we do own that property, and our intention is to use it for maybe primary care, maybe urgent care, maybe other community needs. The city of Eagle has been incredibly patient with us because just as that got turned over to us, COVID was raging. We used it actually for temporary testing. And oh, by the way, the same way we used our old emergency department for testing and vaccinations and monoclonal antibody treatments. So know that we are definitely going to be looking at other ways to help our aging population, and geriatrician is one that Ada Borg, our Chief Operating Officer for CMM, if you're on this call, we'll make sure we bring it up at our next CMM board meeting. But first things first, we got to make sure we have enough staff and space to handle another provider before we exacerbate some of the problems we heard about earlier.
These next few questions, Will, are in regards to insurance. So here goes the first one. Reinsurance, the American Rescue Plan, saved people money on the individual health insurance for 2022. Those savings may go away in the future. What can Vail Health do to make sure 2022 savings continue for locals who don't get insurance through their employer?
Great question. And reinsurance, for those of you who don't know, is insurance to the health insurance companies for those really high cost care events. So if someone had a real severe case of cancer or a premature baby back in Denver, and they were able to take the money and the savings from that and put it back into reducing premiums. And that currently is funded through the federal government. And to date is going to be continue to be funded for the next few years, at least, as we've been working with health insurance companies on what we're going to do for benefit year 23, which starts in January of 23. Those reinsurance savings still exist. And no matter what happens with reinsurance, and no matter what happens with the public option now referred to as the standard benefit design, we will make sure that people who have to go to the individual exchange that's associated with the Affordable Care Act, or even off the exchange, do have a more affordable option. I assure you, I cannot wait until this time next year to not only tell you about how many housing units we add, but to tell you about our local health insurance option. And we are acutely aware of it, and we'll stay on top of it.
Thank you, Will. And I think you actually answered the next two insurance questions with your answer. And those questions were, when will the Eagle River Valley have additional local affordable health insurance options? And could we see an insurance option like the Peak Health Alliance here in Eagle County?
I'm starting to think some of my own team planted these questions because it actually is spot on. And thank you, whoever did give them to us. The benefit year 2023. So yes, we answered that one. But the Peak Health Alliance, just so everybody knows, it's called a purchasing collaborative. And it was another piece of legislation that came out from our local legislators who oftentimes authored it or led it, and from the governor himself. And so that's what Peak Health Alliance is. And the way that we hope to manifest a more affordable option for our locals here is through a similar purchasing collaborative framework. We just hope to brand it as Mountain Healthcare Coalition, which is a subsidiary of Vail Valley Partnership. And we're doing that because, truth be told, in my opinion, and I believe I can speak safely for Chris Romer in this regard too, this needs to be something that's overseen and away from the healthcare system, but know that we'll be there to ensure that we're working on lowered rates and addressing some of the utilization issues. So I think when we talk this time next year, you're going to hear some pretty exciting stuff. In fact, you should be hearing about it in fall enrollment in less than a year from now.
Great. What type of robotic surgeries will be offered?
Boy, I wish we had Dr. Turner Lyle on the phone, or maybe Dr. Clay Pendleton, who does urology type procedures, but we do radical prostatectomies. We do hernia repairs. We do some other types of gynecological procedures. And whoever asked the question, if someone wants to shoot me a note directly at will.cook@vailhealth.org, I'll get you more detailed information. And if you have a question specifically about a surgery you think you might need, we can tell you if that's something we offer on it or not.
Who will be partnering for children under 12 years of age with behavioral health issues who don't meet admission requirements for the future inpatient facility in Edwards?
Chris, you want to take that one for me?
Yeah, I'd be happy to. We actually are very fortunate in this valley. We now have 2 adolescent psychiatrists that are now on staff full-time with Colorado Mountain Medical. Many community members have already got to meet both Dr. Sloan Burton and Dr. Elaine Sanders, and they will continue to provide that care to our community members.
You've already kind of addressed, Will, current and future plans for the Eagle Burger King property. Can you address whether the former urgent care in Gypsum will reopen?
Not with certainty, I can't. And part of the reason it closed is we were seeing 6 or 7 patients a day. And I don't know how much of that was related to the fact that perhaps we didn't market it enough, or how much was related to the fact that it was kind of in an awkward location in Gypsum. We do not mean to imply that those 6 to 7 people per day aren't important, because they surely are. But really, to make an urgent care center work, from a quality and a cost efficiency and staffing perspective, you really need close to 20 a day. And so it was pretty far off the mark. But we're hoping, as we potentially open urgent care at the Burger King site, that maybe that's not just as a little more convenient than what people have today, but we'd be happy to look at it again. My sense is no, we will not. But who knows? More to come in that space.
What are the options for patients with no health insurance? This valley has a seasonal workflow of J1 workers and undocumented workers.
Great. That's a great question. And, I can't emphasize enough how important it is that we not ignore people without health insurance, and some who are undocumented are afraid to surface for all the obvious reasons. And many of those folks really make our economic engine turn, if you know what I mean. A few things. One, there's things like the Mountain Family Health Center, which really is a federally qualified healthcare center that focuses on physical health, behavioral health, and dental health. Ross Brooks is their CEO. They do unbelievable work, not just in our valley, but also in Glenwood Springs and the Roaring Fort Basalt area, maybe even in Rifle. But suffice it to say that trying to get them to that location where they do take people without insurance, working on the Mirror Bus to continue to find ways to get care in some of the mobile home parks, our charity care program where people can pay out of pocket, trying to come up with a more affordable option for folks who live locally, who probably have a good baseline health and just need catastrophic coverage. It's a little bit of everything. But that's my answer for that for now. And I think I have one more question almost related to the same thing, if I'm not mistaken, Sally.
You're correct. Our last question is, are there more programs to address our veterans and their medical needs? Some local providers don't accept veteran health insurance.
Sadly, I think that this is a huge area of opportunity for us. While Colorado Mountain Medical takes some of the veteran health insurance, it's incredibly difficult to even become a provider with some of those programs, but we should not allow something that's difficult to stop us from serving people who've so faithfully and dutifully served us. So I think this is an opportunity for us, and our team will go back and run it to ground and make sure that we, address it with both the local sort of organizations associated with our veterans, as well as circle back to this group when we give an update next year. And I know we're at the end of time and want to be respectful for everybody's time. And again, really end it where we started, which is thank you. It's been a incredibly impactful and rewarding first 3 years here. My wife, Sarah, and I look forward to continuing to raise our daughters, Sadie and Sophia, here. I look forward to continuing to work with and at Vail Health, an amazing board. And we are here to serve this community and the other communities in which we reside. And if there's anything that we can do to help you or to do a better job than we're doing, please don't hesitate to reach out. We're not perfect. We do strive to be great, and we do incredibly value the power of community partnership. So thank you all so much. Be healthy, get vaccinated, and help others who are vulnerable. If you remember anything from today's presentation, that's it. God bless you and thank you. And we look forward to seeing you again next year.